Hi, my name is Nicole Smith, and I'm the Director of Research with Sage Seniors Association. This presentation is an overview of a research project exploring the relationship between hoarding behavior and housing insecurity among older adults that provides insights into system-level responses that could reduce housing precarity for seniors with hoarding disorder. In this presentation, I'll introduce the who, why, what, and how of the research project, review some key terminology in the report, provide an overview of the literature review and data analysis we did, and talk about the conclusions we came to. Sage Seniors Association is a multi-service senior serving organization in Edmonton. We work with all seniors in the greater Edmonton area and beyond, including seniors with complex needs who may be facing challenges such as housing insecurity, physical or mental disabilities, caregiving responsibilities, language barriers, and financial constraints. Sage has been actively addressing compulsive hoarding behavior through the This Full House program since 2007. In 2013, we released a report proposing an integrated community response to hoarding that emphasized comprehensive case management, standardized tools, public education, and interagency collaboration. Sage also helped to co-found the Edmonton Hoarding Coalition, which works to provide integrated services for hoarding cases. Hoarding disorder has a significant impact on individuals and their communities. The demand for hoarding support continues to exceed capacity, and there's a lack of permanent funding for hoarding-related programs in Edmonton. This project builds on the 2013 report by exploring the relationship between hoarding disorder and housing insecurity to identify system-level changes that can support service providers and improve outcomes for an extremely vulnerable population. Hoarding disorder is a mental health issue characterized by an accumulation of possessions that leads to congestion and clutter in living spaces and causes significant distress and impairment in various areas of functioning. The Hoarding Behaviour and Housing Insecurity for Older Adults report considers the progressive and chronic nature of hoarding disorder in older adults who may face additional complexities due to physical limitations and cognitive decline. The growing issue of housing precarity and houselessness among seniors is also considered. With this work, we explored the scope and nature of the relationship between hoarding behavior and housing insecurity in older adults, as well as the interventions employed by community-based organizations, municipalities, and housing agencies addressing the impact of hoarding disorder in their communities. The research involved a phased approach, including an environmental scan, literature review, targeted survey, and interviews with frontline practitioners to explore the relationship between hoarding behavior and housing insecurity and to gather insights into effective interventions. Research participants were frontline practitioners and professionals experienced in hoarding disorder, including people working in healthcare, seniors' health, mental health, housing, fire, bylaw, social services, and law. A targeted survey was disseminated to Edmonton Hoarding Coalition members and 19 organizations identified by the environmental scan. There were 16 survey respondents total, including 2 from outside Alberta. Survey questions focused on the correlation between hoarding behavior and housing insecurity. Interviews were conducted with 6 participants from 3 geographic areas, Edmonton, Calgary, and Lethbridge, including professionals in social work, public health, law, case management, and program instruction. The interviews focused on the systemic barriers faced by service providers in supporting low-resource seniors with hoarding behaviors experiencing housing insecurity. A qualitative thematic analysis was applied to the interviews to identify salient themes and uncover patterns. 3 questions guided the research. First, what proportion of older adults who have been identified as living with hoarding behavior are experiencing housing insecurity? Second, in what ways does hoarding behavior impact housing insecurity for these older adults? And third, what types of interventions are most effective in increasing housing security for older adults living with hoarding behavior? Several of the terms used in this report can signify in different ways, so I want to take a minute to discuss terminology. First, the word senior versus older adult. Depending on the context, the word senior can refer to anyone over the age of 50, but it can also have a legal or policy designation when people are accessing things like housing, income supports, and other social supports. For example, some subsidized housing providers will not accept applications from people under the age of 60. We use the word senior and older adult interchangeably in this report to acknowledge that this demographic includes an incredibly wide span of years and references several stages of life. We also acknowledge that the language we use can contribute to ageism, which is a key barrier to participation for seniors that can significantly impact their quality of life. It can have a negative impact on the mental and physical health of older adults and increase their vulnerability. It can lead to the isolation, invisibility, and social exclusion of older adults. It can be a cause of individual acts of age discrimination, and it can lead to elder abuse. A further challenge with ageism is that people of all ages can hold ageist beliefs, including seniors themselves. This internalized ageism can be a critical barrier to access. When older adults reject the idea that they are seniors, they may be less likely to access the resources, support, and opportunities available to them because of their age. For the purposes of our survey and interviews, participants were asked to consider their work with people over the age of 55. The Canadian Observatory on Homelessness defines the opposite of homelessness as housing stability. Given this definition, the growing awareness of the ways in which the term homeless decenters the individual from the situation they're experiencing, and the potential to experience a sense of home beyond the physical plant of a building, the terms houseless and houselessness are used where possible in this report instead of the terms homeless and homelessness. Prior to being classified as a disorder in the Diagnostic and Statistical Manual of Mental Disorders, hoarding was considered a symptom of obsessive-compulsive disorder. Its designation as a separate disorder is in part because of an individual's hoarding-related thoughts are not perceived as invasive or unwanted as they would be in the case of OCD. Clients accessing supports related to the impacts of their hoarding behavior may or may not have a clinical diagnosis. For the purposes of this report, the term hoarding disorder is used generally to describe a state of struggle with the effects of hoarding behavior and does not presume a clinical diagnosis. The literature review highlights the profound impact of hoarding behavior on individuals, their families, and communities. The link between hoarding behavior and housing insecurity is evident, as it contributes to unsafe living conditions, strained relationships with neighbors, and financial pressures on individuals, service providers, and landlords. The review emphasizes the web of challenges faced by individuals with hoarding disorder, ranging from compromised mental and emotional well-being to heightened risks of eviction and houselessness. The particular challenges faced by older adults, including challenges related to physical health and the long-term impacts of hoarding behavior, highlight the need for a tailored intervention that addresses their unique circumstances. Hoarding disorder is a public health concern with wide-ranging impacts on individuals, their families, communities, and even animals. The emotional and mental well-being of seniors with hoarding disorder can be significantly affected and lead to isolation and feelings of exclusion. Family members also experience negative consequences, including impaired relationships, divorce, loss of normal family life, and reduced living space. Existing research identifies a close link between hoarding disorder and housing insecurity, with a significant proportion of individuals with hoarding behaviors facing or being at risk of houselessness. The consequences of untreated hoarding disorder include tension with neighbors, legal issues, financial pressure, and employment difficulties, which all contribute to increased housing insecurity and social exclusion. Hoarding behaviors also lead to physical and mental health challenges, which can affect an individual's ability to seek support and succeed in interventions. Hoarding behaviors also create environmental and health risks, and in high-density housing, these can affect the housing security of all residents. Older adults and seniors are particularly vulnerable to housing insecurity caused by hoarding disorder. The manifestation of hoarding behavior begins at a young age and tends to worsen over time. The compounding effects of housing and unemployment and employment insecurity comorbidities, and increased isolation make seeking support difficult for individuals with hoarding disorder, and that can be exacerbated by a fear of judgment and stigma. Research recommends early intervention for hoarding disorder to address symptoms before they worsen over time. Older adults with hoarding disorder require comprehensive support for their physical, mental, social, and financial well-being. The services accessed by people struggling with hoarding behaviors include support groups, professional organizers and junk removal, in-home support services, legal services to prevent eviction and houselessness, and therapy. Cognitive behavioral therapy, or CBT, is identified by the literature as an effective treatment that promotes needed problem-solving skills, new behaviors, and beliefs about hoarding. Group CBT programs are particularly beneficial for older adults because they reduce isolation and feelings of shame and guilt. The multifaceted challenges faced by individuals with hoarding behavior extend beyond their immediate living conditions and affect relationships, safety, and overall well-being. Effective interventions must ensure that a client's situation and symptoms are not exacerbated and should empower clients through strength-based and person-centered approaches. Case management and harm reduction strategies are effective approaches to supporting people with hoarding disorder because they leverage the skills and abilities of the client, help them set achievable goals, and address health and safety risks. The complexities of case management for older adults struggling with hoarding behavior have led to growing support in the literature for service coordination and interdisciplinary approaches to service provision. An interdisciplinary approach to addressing hoarding disorder links together professionals from different fields, enables greater collaboration and streamlining of services, and facilitates the development of wraparound supports. Integrated approaches to case management foster a holistic approach to service provision and support proactive and timely solutions to complex concerns. Interdisciplinary teams draw on the expertise of different fields, like health providers, animal control, law enforcement, and mental health, to help clients manage their unique circumstances at each point in their treatment, increase the effectiveness of hoarding interventions, and improve outcomes for clients. An interdisciplinary approach can improve intervention outcomes because people with hoarding disorder often present with additional vulnerabilities or comorbidities that one service provider cannot adequately address, including behavioral issues, stigmatization, isolation, housing insecurity, acquired brain injury, physical, mental, or neurological issues, and/or drug addiction. Challenges such as policy restrictions and bureaucratic bottlenecks, for example, confidentiality or capacity concerns, can hinder effective assistance for clients, and there is a need for improved collaboration and communication among service providers. Identification of and outreach to people struggling with hoarding disorder can be extremely difficult, and strong local networks with knowledgeable staff can strengthen the referral pathways necessary to engage them when they first access supports, even when those supports are not hoarding related. Service providers indicate that there is a significant financial cost to managing clients with hoarding behaviors, including active treatment, pest control, medication and medical supplies, and legal services. Financial support for clients is also necessary to ensure that those in need of intervention and treatment can access help without significantly impacting their financial stability. This is especially relevant for people with lower and/or fixed incomes. A 2018 study on service provision for people struggling with hoarding behavior in Ontario identified 4 key issues when addressing hoarding situations: coordination of care, developing trust with clients, securing resources to support clients, and the prevention of a recurrence or high-risk situation. The study includes an infographic that demonstrates current service pathways and proposes an ideal service pathway for supporting clients with hoarding disorder. The ideal pathway includes a project manager, centralized intake, and process plan that coordinates services as needed over time. The effect of hoarding disorder on landlords needs to be considered in service coordination and delivery as well. When securing tenancy and reducing housing insecurity, landlords and housing providers become key stakeholders in a client's intervention. The effects of hoarding disorder can present significant financial costs to landlords, including pest infestation and animal control, health and safety code enforcement, lost rent, cost to evict, and heavy cleaning. Repair costs are also higher for tenants with hoarding behaviors because of their reluctance to report issues or give repair people access to their apartments. Pervasive odor and the ability to attract other tenants have been identified as significant issues as well. Landlords in one study felt that rules and policies limited their ability to address hoarding behavior and placed the burden of health and safety violations on them, and expressed frustration with the responsibility of managing tenants with hoarding behaviors despite not having the resources, knowledge, or ability to help. This is an example of the need to engage and inform all community stakeholders, including landlords, to facilitate greater empathy, understanding, and acceptance. The nature of hoarding disorder requires a comprehensive understanding of its implications for effective intervention strategies. The literature supports cognitive behavioral therapy and harm reduction strategies as effective means to mitigate the impact of hoarding behaviors. Case management, especially in the context of an interdisciplinary approach, emerges as a crucial factor in providing holistic support to individuals struggling with hoarding disorder. Service coordination, interdisciplinary collaboration, and community engagement are identified as key components in enhancing the effectiveness of interventions and mitigating the associated challenges. The research for this project focused on the correlation between hoarding behavior and housing insecurity among low-resource seniors and reinforced the conclusions of the literature review. Results are presented here as 3 separate but interconnected responses to the questions that guided this research. A key question underlying our research was related to the correlation between hoarding behavior and housing insecurity. We wanted to learn what proportion of low-resource seniors who have been identified as living with hoarding behavior are at risk of houselessness. When asked how hoarding behavior affects the housing security of their clients, survey respondents indicated that hoarding impacts the financial security of clients, for example, unpaid bills and rent, and places strain on relationships that can result in the loss of shared housing. Concerns related to pest control, air quality, fire safety, and lack of access for repairs or maintenance and/or egress for first responders create tension with neighbors and landlords who may pursue enforcement options and/or eviction. Interview participants indicated that seniors are often identified as living with hoarding behavior because they are experiencing housing insecurity and their condition has been revealed during an assessment process. Seniors are also more likely to reach out for help only once the threat of eviction is imminent. This is significant because the primary driver is not a desire to address their hoarding behavior. They're compelled to seek support as a result of the crisis. This is indicative of the way in which housing security is centered as the primary concern of hoarding disorder for service providers. The goal of many hoarding interventions is to prevent eviction, and that is a key marker of success. To effectively address hoarding disorder, post-crisis case management and peer and/or mental health support is necessary to prevent a recurrence. The crisis intervention itself can act as a triggering event and compound the desire to acquire and retain items, and without post-crisis treatment or support, most people will simply start the acquiring cycle again. The net effect is that the intervention, which is resource-intensive and expensive, becomes part of the cycle and practically guarantees another intervention will be required later on. To break the cycle, sustained support that addresses underlying mental health concerns and other needs are required post-intervention. Post-crisis case management, peer support, mental health services, and addiction treatment are identified as crucial components to prevent recurrence and increase housing security. It is important to note that not all seniors dealing with the effects of hoarding behavior become visible to the system as a result of a housing crisis. As people age, they may be motivated to address their hoarding behavior because they're concerned that declining health may prohibit them from doing so in the future. As a result, their entry point will be different, but they will nonetheless require long-term support to manage their disorder. The impact of hoarding behavior on housing insecurity for older adults is straightforward and significant. For seniors facing eviction, addressing the hoard is a condition of their ability to remain in their home. This in turn has a profound impact on the nature of the intervention that results. When clients are identified because of an imminent housing crisis, it is the crisis that becomes the focus of the intervention. But the housing crisis is rarely, if ever, the only issue. Older adults with hoarding behavior are often referred to their programs by other organizations, including home care, hospitals, nurses or social workers in medical settings, mental health professionals, landlords, or housing providers, and fire crews. The long-term success of an intervention is often dependent on four intersecting factors: time, a sense of control, motivation, and insight. First, the inability to be part of the decision-making process will create anxiety for clients, many of whom will already have had an experience where a well-meaning person has attempted to clean out their space despite their protests. Making the decision to discard items can take a significant amount of time for clients because they're struggling with an unhealthy attachment to their things that is rooted in their hoarding disorder. The extreme time constraints tied to a crisis intervention approach focused on preventing eviction limits control for and possibly re-traumatizes clients, significantly reducing the potential for insight and motivation to develop, and essentially ensures that they will reach the crisis point again. The case management model is largely effective because it is relational in nature. Case managers establish rapport with people who have been isolated by their disorder and help them be safe and healthy in their homes without removing control or decision-making power from them. Harm reduction is used to keep control and decision-making in the hands of the senior. Effective post-crisis treatment includes addressing the core reasons for the behavior. This has the greatest potential for the client to develop insight and motivation to change, which will ultimately lead to better outcomes in the long run. It is important to acknowledge that while the housing crisis is often the point of entry for intervention and treatment, it cannot be the sole focus. The hoard must be dealt with, but it is rarely the only problem. The senior is also very likely dealing with physical, mental, financial, and other concerns that need to be addressed. Because the current system is centered on the symptom, the housing crisis, and not the condition, hoarding disorder, that is where the bulk of funding is spent. There is little money for aftercare. But hoarding disorder is a chronic and progressive illness, and the recidivism rate is quite high, which underscores the need for long-term treatment and support. Interview questions related to the types of intervention provided the most insight into the nature of housing insecurity as it relates to hoarding disorder, because it highlighted systemic issues that need to be addressed in order to, 1, increase housing security among people struggling with hoarding behavior, and 2, decrease the impact it has on community. The interviews revealed 2 different community-based approaches to addressing hoarding behavior. The first is the collaborative approach taken in Edmonton, where representatives from different stakeholder groups come together as part of the Edmonton Hoarding Coalition to identify supports for clients, share knowledge and identify resources, and raise awareness of hoarding behavior. The second approach is employed by Lethbridge, where the Hoarding Outreach, Management, and Education, or HOME team, works to help individuals address their hoarding behavior and quality of life, coordinate interventions and supports, and act as a resource for individuals and agencies. Case managers in both models have expertise dealing with hoarding behaviors and navigating the system of supports that can help to keep clients safely housed. A critical difference between the two is the role these case managers play at the systems level. In Edmonton, case managers represent individual organizations and work collaboratively with other coalition members on a case-by-case basis. In Lethbridge, the case manager owns the hoarding portfolio and works to support both individual clients and the organizations involved. In Lethbridge's coordinated model, an established referral pathway triggers a case manager who has expertise related to hoarding disorder and knows how to navigate the system of supports. The case manager then takes over and relieves the initial service provider from responsibility for the concern. The referring organization may continue to be involved, but only in a supporting role as appropriate. The collaborative approach to hoarding employed by Edmonton organizations is largely a response to the lack of dedicated funding for hoarding interventions. Participating organizations are working together to address the needs of a highly vulnerable population, often off the sides of their desks. The result is that extremely limited resources need to be focused on the most critical concern, the housing crisis. Resolution of the crisis effectively closes the case, and success is measured primarily as the prevention of imminent houselessness. In the Lethbridge example, the client is generally identified because of the housing crisis, but remains a part of the case manager's caseload even once that crisis has been managed, although the number of interactions will decrease and may simply involve regular check-ins to prevent escalation. A file may close if the senior has been moved into congregate living or if the individual has been connected to other supports who can make the home team aware of an impending concern. The case manager will also close the file when the person is no longer visible to them, approximately 6 months with no contact, but because the home team is aware of them, the file is not so much closed as dormant. So, for example, organic and non-invasive check-ins happening. In Lethbridge, the case manager position is employed by a nonprofit subsidiary of the Lethbridge Housing Authority, and that dedicated funding helps support system coordination, awareness, advocacy, and intervention. It also means that the approach is essentially a housing first, but not last, strategy that acknowledges that the problem is not likely to go away, it can only be managed. Both interview participants working in the Lethbridge model reference the importance of sustained surveillance post-crisis. The ability to have eyes on clients in non-invasive ways can prevent an escalation to the pre-crisis state. It's a form of system-level harm reduction that focuses on providing hoarding and non-hoarding related supports that improve the quality of life of the client and stabilizes their situation over time. For example, arranging for food delivery through Meals on Wheels not only improves the food security of the senior, but ensures that there is someone who knows to contact the home team if they become concerned about their client's living conditions. It's a coordinated effort focused on prevention and employs a sustained harm reduction approach that recenters the senior after the crisis has passed. Home team organizations work to improve systems and educate staff and stakeholders about hoarding disorder in accordance with their work. For example, a checkbox to flag potential hoarding concerns has been added to forms used by bylaw officers, and this would require bylaw enforcement to embed information on what it is, why it's there, and what happens if it's checked into existing training and onboarding processes. With this approach, awareness efforts can be diffused across stakeholder groups in the way that is most relevant to them. The lack of financial resources to support the logistics of an intervention, for example, junk removal and storage, is problematic in both cases. But the lack of sustained funding for case management and coordination in the Edmonton model means that a significant amount of time is spent trying to secure funding for the program itself. Interview participants also identified systemic barriers they face when working with older adults who are struggling with hoarding behavior. The lack of resources to undertake cleaning and decluttering, support programs, and mental health supports were all identified as priorities. The limited funding available in Edmonton is largely focused on crisis intervention. Continued funding to help clients maintain their space post-intervention would help prevent another crisis, but is not currently available. A significant challenge for both models, Edmonton and Lethbridge, is trying to secure the resources needed to help with decluttering, and a lot of time can be spent trying to access funding for clients through income supports. Clients experiencing a housing crisis as a result of their hoarding behavior are very likely to be financially insecure and are not able to pay for decluttering, storage, cleaning, or post-intervention maintenance. This problem is exacerbated for seniors who are also likely to have physical health issues that limit their ability to undertake the work themselves, things like lifting and hauling. A correlated concern is the general decrease in volunteerism that has impacted the nonprofit sector since the onset of COVID-19, as community-based responses to hoarding rely heavily on volunteers to support the work. There's also a general lack of affordable housing, and wait lists can be prohibitive. And for older adults who may need to move into higher levels of care as they age, their untreated hoarding disorder can prevent them from accessing supportive living, which leaves them no option for safe, appropriate housing. The lack of coordination at a systems level creates confusion and unnecessary bureaucracy, which can be particularly difficult for people facing a crisis and dealing with multiple barriers. The classification of hoarding as a standalone disorder in 2013 was a significant step toward reducing housing precarity, in part because it provides the baseline for a human rights argument in court when clients are facing eviction. Due to its clinical designation, hoarding disorder can be considered a psychiatric disability that landlords must accommodate under the Alberta Human Rights Act. Eviction cases and appeals currently need to be transferred to the Court of King's Bench to address the human rights issue, but the process involved is time-consuming and expensive. This represents a critical systemic barrier that could be overcome if eviction cases related to hoarding were deferred to the provincial court automatically. Interview participants also discussed barriers related to the policy requirements of different organizations from multiple sectors, including those related to confidentiality and insurance, which can impede information sharing and collaboration on individual cases. This is somewhat mitigated in the Lethbridge model, where the case manager acts as the point person and can protect the privacy of the client. The imminent threat of eviction often propels older adults to seek help, which, when coupled with limited program resources, centers the housing crisis in the intervention rather than the hoarding disorder itself. While crisis intervention is often a necessary first step, it cannot be the only step. Post-crisis engagement and support is vital for preventing another crisis and supporting the well-being of the senior. The complex challenges faced by older adults struggling with hoarding disorder require a comprehensive, long-term approach that goes beyond crisis management. By addressing root causes, providing sustained support, and coordinating efforts at the community and systems levels, interventions can aim not only to prevent immediate houselessness, but help seniors to manage their hoarding behavior, improve their overall well-being, and support healthy aging in place. The coordinated model used in Lethbridge is a systems-level approach that can streamline referral pathways and increase efficiency and efficacy when addressing hoarding disorder and housing security in older adults. The 2013 Integrated Response to Hoarding proposed by SAGE concluded that coordination of services would increase access, improve system-level efficiencies, and decrease the burden of complex cases on individual organizations, and called for dedicated funding to sustain an integrated response to hoarding over time. This report draws the same conclusions and recommends investment in a coordinated approach to addressing the impacts of hoarding disorder on older adults and their communities. The correlation between hoarding behavior and housing insecurity among low-resource seniors necessitates a shift in focus from crisis intervention to sustained support. Hoarding behavior is rarely a standalone issue, and intervention strategies must address the complex nature of cases and prioritize healthy aging in place. Continuing to focus on the symptoms of the disorder, housing precarity, almost guarantees that the crisis will happen again. Thank you.